Alrighty, so I want to be respectful of everybody's time and I will continue to let people in as we go. So, hello everybody. Thank you so much for joining our Special Olympics New York Virtual Health and Wellness Forums tonight. My name is Maddie Hasbrook and I am the Associate Director of Health and your moderator for tonight. If this is your first time joining us, welcome. Our forums are a space for individuals with ID, families, caregivers, health professionals, and our Special Olympics coaches to engage with health professionals and fitness specialists. The forums provide information and resources related to the health of Special Olympics, as well as focusing on bettering access to healthcare, education, and inclusive activities for people with intellectual disabilities. Throughout tonight's presentation, we ask that you stay muted, but feel free to use the chat as I will be looking at that. And there will be time at the end for questions as well. So I would like to introduce tonight's speaker, Randy. Randy has a Master of Science in Education from Queens College, a Certificate of School Administration and Supervision from the College of New Rochelle, and is currently a doctoral candidate in the Educational Leadership Program at Concordia University. She started her career as a special education teacher in a public school in Nassau County, and then spent close to 30 years in senior leadership positions at nonprofit organizations serving children and adults with autism in New York City and Long Island. Randy is also a seasoned runner and has participated in countless road races and marathons, including the Blazing Trails Run and Walk, raising well over $65,000 in the past 15 years to benefit the autism community. So tonight, Randy will be sharing information on understanding and planning for the needs of older adults with ASD. So, Randy, I will turn it over to you.
Thank you. Thank you for your interest in this topic, and thank you for the invitation to present at your forum. It's an honor to be here with everybody today. There are approximately 500,000 seniors on the autism spectrum in the United States. The needs of seniors with autism spectrum disorders are different from the needs of those in young adulthood or middle age. In addition, due to the many specific health and behavioral factors, the needs of seniors with autism may also be different from those without autism. It's urgent for us to better understand the language, learning, medical, and behavioral characteristics of seniors on the autism spectrum to both ensure a high quality of life for them during this time in their lives, but also to be able to more effectively address the factors that result in a morbidity rate of at least 20 years earlier than the non-autistic population. This presentation is designed to promote dialogue about health outcomes and challenges in individuals with ASD as they age. A focus will be on preparing and supporting these individuals in sports and recreation and leisure activities. We will describe how building strategic partnerships is critical in addressing the needs of aging individuals with autism. This topic is very near and dear to my heart. The individuals that I'm working with now, many of them are in their 20s, 30s, and 40s. And I started as their preschool teacher when they were 2, 3, and 4 years old. So I have the pleasure and honor of working with my students throughout their lifespan. That's one of the mission-driven parts of Eden 2 programs, is that we really provide supports and services to individuals from early childhood through adulthood. I've run several local mainstream races as a coach for individuals with autism, and have shadowed and supported an adult with autism through many races, including New York City Marathon and Marine Corps Marathon. So this is one of my favorite topics to talk about. Individuals with autism spectrum disorders often do well in organized and structured situations, and they often thrive in situations that involve routine and scheduling. It's important for them to be able to have leisure time and be able to enjoy downtime at home, in the community, or at a job site. One of the more difficult times of the day for many individuals with ASD is when there is a break at home, in school, the community, and at work. Individuals with autism may be more likely to engage in challenging or disruptive behavior or ritualistic behavior, or become a distraction to others in less structured situations. Some individuals with autism might likely choose to work rather than to engage in leisure tasks because they simply don't have well-developed leisure repertoires, and it's actually more of a chore to engage in leisure activities than to do very structured work tasks. It's important to teach both solitary and social leisure skills and provide options for adolescents and adults with ASD so they can engage in leisure skills that are truly enjoyable to them, and make choices just as the typically developing population does. And just let's review a little bit about what some of the research tells us. In a group of 20 adolescents with Asperger's syndrome, authors found that none of them were considered by their parents as capable of engaging in leisure activities outside of the home, or traveling independently, or making competent decisions about self-care. And this is among a subgroup of individuals with autism that have normal IQ. Social participation with friends was a factor that most differentiated adolescents with ASD from those in other three disability groups included in a study. Those with autism had fewer experiences with their friends outside of school and were 3 to 5 times more likely to never get together with friends compared to peers from other disability groups. So even when you compare individuals with autism to individuals with other disabilities, they're far less social and integrated with their peers and friends. Social skills and leisure skills affect relationships, so these are very important areas to develop. And obviously, the lack of social and leisure skills can really impact the family because many of our individuals don't do well in unstructured activities or downtime. We see a lot of our families on the go, just trying to fill up time with different activities. Many families experience a lack of enjoyment in sharing activities together. It's stressful for families because they must be on all of the time. And there may be perseverative behavior, which can take a toll on a family. This also has an impact on siblings. There are less opportunities for families to engage in activities with siblings of individuals with autism spectrum disorder. So there are some evidence-based interventions that have been shown to be effective in teaching leisure skills, and these things range from video modeling to video prompting, and there are ways that we can promote choice and independence in leisure skills through training and through social stories and providing any kind of cognitive behavioral intervention and some cooperative play-based behavior. And research does suggest that we can specifically teach these skills and increase the repertoires of leisure and recreation activities that our individuals engage in. Leisure skills are those skills and interests and hobbies that most of us have that serve the function of unwinding, relaxing, or simple enjoyment. What are some of the roadblocks in individuals with autism? Many of our individuals have limited interests or interests in things that are not generally thought of as recreation, leisure, sports, and fitness. Our individuals might experience a lack of endurance for certain activities. They might be able to do things for a couple of minutes or a couple of hours, but for long periods of time, we see some fatigue. Many of our individuals don't have a variety of activities that they engage in. They might perseverate on certain activities in the community and engage in behaviors that are really repetitive and stereotypic. A lot of our adults with autism maintain their interest in things that might not be considered age appropriate. So it's not uncommon for some of our teenagers and adults to be interested in things that they were interested in when they were a child. In most cases, it's a skill deficit, right? They have not been specifically taught to engage in these kinds of repertoires of behavior. And social skills deficits definitely are a roadblock in the success of our individuals in these activities, as well as engaging in problem behavior ranging from aggression to self-injury, to just need for sameness. And many of our individuals are not able to make choices, or limited choices are provided to them because they might need support in situations that they might not have access to. So the goals of leisure programs and recreation, fitness, and health programs, obviously one of the benefits is to promote physical fitness. We build friendships and develop social skills through this domain. There are inclusion opportunities for families, for day programs in schools and communities. And family participation in an activity is critically important for individuals and their families that are experiencing autism. Some of these things actually promote school spirit if you're part of a team or you're part of a, color war kind of activity, right? These are things that definitely typical kids get to experience. There are obviously a lot of health benefits to leisure programs. And just appearing to be part of something or an activity adds this level of social competence. Building leisure programming also comes into play on the job, whether it's volunteer or paid employment. Through leisure programming, we're often building skills like strength, flexibility, and endurance, which transition or generalize to other vocational settings. Improve overall quality of life, promotes a feeling of accomplishment and belonging. So some of the components of effective programming in every domain, whether we're talking about academics, vocational programming, socialization, or leisure skills, is collaboration with families, assessment, appropriate selection of curriculum targets and instruction, the ability to teach in one setting and then generalize and probe for maintenance of skills across other settings. Many of our individuals benefit from individualized or customized instruction. A huge component, and I think this comes into play in Special Olympics and other kinds of sports or leisure activities, is staff training. Ongoing staff training on the learning characteristics of individuals with autism, as well as professionalism as it relates to supporting and coaching an individual in a mainstream setting. We rely a lot on research-based strategies and interventions. Applied behavior analysis is the only treatment approach for individuals with autism that has empirical validation to support its efficacy. So we're very research-based in some of the strategies that are effective in our programming. And we make database decisions based on information that we're collecting and monitoring. It's important to assess preferences for our individuals for specific skills, whether it's cooking or reading or running or swimming or horseback riding. Assess the preferences in specific locations. Some of our individuals might like to do an activity if it's not crowded or if it's not noisy. And those features like noise and crowded places can make individuals avoid engaging in certain activities that they would otherwise enjoy if it weren't for those variables. And presenting our individuals with choices to assess their preferences is super important. And we need to make considerations for students who are verbal and can express what they like and dislike, and also understand how to communicate with individuals that might not have spoken language. And then also assess preferences for a solitary activity versus a social activity. So running and jogging might be more solitary than playing like a soccer game, right? So we have to be sensitive to these preferences. We want individuals with autism to be able to have a balance of solitary and social leisure skills in their lives. Both types of leisure skills can be taught using teaching methods that are based in applied behavior analysis. Some activities can be group and could also be individual, like playing video games, watching TV, or shopping. So how we assess preference is we simply ask the individual. We observe behavior in different settings and situations. We can interview family members and teachers and other members of the individual's network. We can give choices and see if you're offered 3 things or 3 activities, which one would you choose? And we can observe a lot of behavior and notice an individual's affect in different situations. And that can give us information as to whether they're interested, enjoying it, simply just tolerating it, or can't wait to be done with it. Very often, students and individuals let us know. We just need to listen to them. So the importance of choice in supporting individuals throughout their lifespan is super important. I took this these young twins that I work with, and the last day of school, if you look at a favorite activity, Max says his favorite activity is sleeping. And that's kind of cute when you're that age. But I also know individuals in their 20s, 30s, 40s, and 50s that would prefer to sleep than to do anything else. And I draw our attention to this must-read article because leisure and recreation is one of those areas where it's really your choice to participate, right? Living, you have to live in a house, and working, you kind of have to go to, but recreation and leisure, there's a lot of opportunities for choices. And we want to give our individuals the skill sets to be able to engage in these repertoires and then have them make the decision as to whether they want to or not. Many of our individuals opt out or engage in escape-related behavior because they simply don't have the skills to participate. So this is an old article, but it's really important. Balancing the right to habilitation with the right to personal liberties. And this was the right of people with developmental disabilities to eat too many donuts and to take a nap, right? I think everybody has the right to eat a donut and to take a nap, but I don't want them to choose those things because they haven't learned to do other things. So when we talk about an individual's well-being, we're talking about their physical well-being, emotional well-being, their relationships, social inclusion, their personal growth, their material well-being, and all these together interact to form the quality of life for the individual that is experiencing autism. I met a family many years ago. These boys are now 34 years old. I met these guys when they were just diagnosed at 3 years of age, and they both became very interested in running mainstream races. And their mom wrote a book called Silent Running, and it's about their family's journey through autism. And I'm going to play you the book trailer here, and then you can learn more about it and get the book on Amazon if you're interested in it.
I always dreamed of being a mother, so when my beautiful twin sons were born, my husband Alan and I felt truly blessed. Allie and Jamie were perfect babies. They were delightfully playful and happy, until one day they stopped smiling. At 21 months old, both Allie and Jamie were diagnosed with autism. I trembled uncontrollably at the news, feeling frozen in time and space. But in that blinding fog, I found a path to follow to find a cure for my sons. Partnering with other parents, we opened a school exclusively for children with autism based on the principles of ABA, Applied Behavior Analysis. The boys made steady gains, but when they turned 5, I accepted the fact that they were not going to be like other kids. They were severely autistic, nonverbal with extreme and challenging behaviors. I shifted my focus from finding a cure to seeking happiness for my precious sons. They enjoyed many activities such as swimming and horseback riding. But then we found running. Allie and Jamie were naturals. They ran with dedicated coaches to ensure their safety. Alex was the fast one, the competitive one focused on the finish line, while Jamie ran for fun, wanting to socialize with other runners. Then my husband started running with Jamie, even while managing his MS. The boys began running in mainstream races, flashing huge smiles at the finish line. A new world had opened up for us. We became a running family. What was once the feeling of cold and darkness within me had now become that of warmth and optimism. Allie and Jamie were happy, and I'd never been more proud of them. But then I was overcome by a new heaviness in my heart. I was diagnosed with aggressive breast cancer. I didn't fear for myself as much as I was concerned about my family. I used that heavy feeling as motivation and laced up my own running shoes. And after the battle, I won. Now I run races with Jamie, while Allie amazes us all as he gets faster and faster. The sound of our shoes on the trail binds my family to one another, brother to brother, parents to sons. Since 2005, my sons have run in over 150 races, including many New York City and Boston marathons. Running has leveled the playing field for Allie and Jamie. They are no longer defined by their autism. They are my sons, and they are runners.
So one of the most important things I think that we can do to support the individuals that we work with is to make sure that they are being coached or supported by people who are competent and skilled. So some of the coaches can be school staff, parents, peer leaders, community members, must be trained in autism and developmental disabilities, must understand prompting and reinforcement techniques, must understand safety skills, and be willing to take risks on the road and in trails, willing to dress appropriately and come back to school without showering. We started a run club at our school, and we had to really train our staff in being able to run, number one, and support our individuals, but also be willing to, get sweaty during the workday and come back and not necessarily have the opportunity to take a shower, right? So it's really like a lot of considerations when you're looking at pairing people in community events with individuals with autism. Especially these boys are nonverbal, so running with them, you really have to be in tune with their behavior. You have to be in tune with their fitness and health levels, right? Know when they're too sweaty or might need a break, know when they might need to drink water. Jamie and Allie wouldn't necessarily initiate drinking water when they're thirsty, so they have to be prompted. So coaches really have to be in tune to delivering those kinds of things when exercising in the community. So some of the teaching strategies that we use are graduated guidance and gestural prompting. We do spatial fading, some shadowing. These particular boys, the tether was never really effective with, but we have other individuals where, we might start with a tether and then fade it. The instructor pairs verbal directions with gestural prompts. And for a lot of our individuals, the use of written scripts are helpful. So before we go out on a run, we might give Allie a bracelet, and on his bracelet it will say, run, drink water, run, wipe your face, right? Some of those written kinds of prompts or scripts were very important for him. Increasing the leisure and recreation skills in our individuals also give us another venue to teach other things, right? So many of our individuals, like the boys are really good in running races, but when they did cross country in their high school, prepping for locker room behavior was a disaster for them. So we needed to create daily living skills schedules for them and help support them through the locker room. Increasing vocabulary related to running, right? That's a whole new area for us to teach, maybe in a more academic setting, right? Teach interval training, teach sprinting, teach jogging versus running. And I think one of the things that was really important for us that we learned the hard way was before you start any kind of leisure or fitness program, especially something as rigorous as training for mainstream races, is to get our individuals fitted for sneakers. Blisters and the wrong size shoe and chafing, those are kind of like things that can happen to our individuals, and they might not have the verbal ability to communicate that. So Allie, for example, one time ran with a bloody blister for hours before in a marathon before anybody even knew that it was an issue. He just didn't feel pain. He didn't attend to it. He didn't report it, right? So getting fitted for the right sneakers, wearing the right clothes, prompting the individual to use things like Glide, which is, to prevent chafing. All of these things come into play when we're teaching and supporting our individuals in these activities. Other ethical responsibilities to the individuals we serve is to not take the easy way out. We need to include the individual and their caregiver in all of the decisions. We need to teach and promote choice making. We need to reinforce choice making throughout the lifespan and provide instruction in areas of interest. Respecting a person's autonomy and self-determination or dignity to make choices for himself or herself is perhaps one of the most difficult concepts of parents and professionals of individuals with autism. It involves major concerns about decisional competence and legitimate concerns about health, well-being, and safety risks. This is another one of my students that I worked with for over 20 years, and we used to practice teaching Jonathan endurance to stay on a task, endurance to run for longer periods of time. And with all we did to build up his endurance, he also ran in over 20 marathons, including one ultra marathon. I want to talk to you a little bit about quality of life and give you an example of how this came into play with Jonathan. All persons enjoy the right to be left alone, the privilege of an individual to plan his own affairs, to shape his own life as he thinks best, to do as he pleases, go where he pleases, the freedom to walk, stroll, or loaf. What happened with Jonathan in the Boston Marathon one year, I don't know if any of you guys remember, but there was unusually high temperatures forecasted for that race. And the Boston Athletic Association gave participants the opportunity to defer the race and automatically get guaranteed entry into the following year. Now, Jonathan's nonverbal. Jonathan can't read these alert levels or even understand what they mean, right? And so we had this extreme alert level, which meant that they was dangerous conditions, and the recommended actions were to stop or to not even start, right? And it was really hard for Jonathan's mom, because think about this, right? He's unable to communicate. He's unable to report health conditions. He is supported by a coach whose family and friends all went from New York to Boston to run in this race. They spent months and months of training, thousands of dollars in supporting him, hotel rooms, right? The whole logistics was planned, and they got there the day before and they had to make the decision to not have Jonathan run. Jamie and Allie's parents made a different decision, and they allowed the boys to run, and they took other precautions like run slower, stop if you have to. But Jonathan's family decided that it was best that he didn't run. And I bring this up because I think it's important for us to help our individuals make these decisions, or in a lot of cases, we have to make these decisions for them because they're not able to. But health and safety has to be on the forefront, and we have to understand that our individuals can't communicate the way that typical people do. Just some other things that we do in our program, less rigorous than sports, puzzles, board games, art, dance, and the things that music, movement, sports, fitness, all of these kinds of things have in common generally is there's a warm-up, there's movement, there's cool downs, and all of these things kind of work on following directions, social interaction, flexibility, balance, rhythm. So it's just about finding the venue that you want to practice all of these skills and behaviors, and then providing the most amount of effective support in these situations. I want to talk a little bit about seniors with autism. And when I say seniors with autism, I'm talking about individuals that are older than 20s and 30s, but maybe around getting to be in their 40s. We know senior citizens, and the typical population is defined by 55 or 65 years old. I would argue that seniors with autism, a little bit younger than that, we might start categorizing them as seniors. One of the most complicated and worrisome issues facing families and providers of individuals with autism is providing long-term living and learning opportunities once they reach adulthood. For over 2 decades, we were talking about the service cliff. That was when individuals aged out of school programs at 21 and began to enter adult services, adult day programs, or other kinds of options for post-21 education. Our actions and plans are just starting to catch up with what we knew was going to be a tsunami of individuals with autism entering into adulthood and in need of adult services and supports. A parallel situation is beginning to emerge with respect to seniors with autism. Like I said earlier, there are approximately 500,000 seniors on the autism spectrum in the United States, and the needs of seniors with autism are different from the needs of others in young adulthood and middle age and in middle age. It's urgent for us to understand the learning, language, medical, and behavioral characteristics, and the needs of seniors on the autism spectrum. In the general population, there are issues with aging, right? Engagement and purpose, for example. Helping older adults get and stay meaningfully engaged is critical for their health and for the health of their communities. Remaining safe and mobile are top priorities for older adults. 1/3 of people over 65 need assistance with at least one activity of daily living, for example, eating, bathing, and dressing. Families need support and training. On the professional side, staff shortages and quality of care are huge concerns. Post-COVID made this even exacerbated. 2/3 of seniors have at least 2 chronic conditions. 10% of adults 65 and over develop Alzheimer's disease, and this percentage doubles every 5 years after that. In addition to the unique language, learning, and behavioral characteristics of aging individuals with autism, there are additional health concerns, mentally, physically, and emotionally. It's common for seniors with autism to have difficulty explaining states of health. For example, they might not tell you that they're experiencing stiff joints, leg cramps, or heart arrhythmia. Individuals with autism, if they don't practice some of the skills that they once learned or mastered, those skills might drop out of their repertoire, right? So it's hard to tell if losing skill is related to just lack of retention because it's not a fluent behavior that's been practiced, or because this is the aging process that you see in typical people, maybe who are experiencing early onset of dementia or Alzheimer's disease. Autism is often associated with co-occurring sensory, physical, and mental health condition. Our population is 4 times more likely to suffer gastrointestinal problems and twice as likely to have a psychiatric diagnosis than the general population. Although they are at an older age, they might be stuck in the interests and behaviors of younger people, such as liking or even obsessing on childish movies, music, toys, or games. Aggression and self-injury could be present. Problems with accessibility to services of all types, like residential and housing. Lack of appropriately trained support personnel. Lack of lifelong learning environment. In order to support seniors with autism, staff will need additional training in medical and other comorbid conditions. We must bring in the right expertise into our programs. Older adults with autism are at high risk for a broad array of physical and mental health conditions, including diabetes, depression, and heart disease. These individuals are 2.5 times more likely to die early as compared to their neurotypical peers. Some reasons for that could be missed medical appointments, a lifetime of being on various medications, and a history with self-injurious behavior. More than half of people with ASD have 4 or more co-occurring conditions, like epilepsy, gastrointestinal conditions, OCD, and depression. We have to help prepare for an eventual loss of skills or reduction of skills like hearing, vision, balance, and flexibility. Although the onset of aging effects are gradual, a person with autism may experience it as sudden. For example, not realizing they're losing their hearing until they do realize it and they have already lost their hearing. Diminished hearing and sight, aches and pains can lead to a grumpy disposition. It's really important to bring together expertise on aging as well as on autism spectrum disorders. Our agency is located in Staten Island, which is one of the 5 boroughs of New York City. So I did just some preliminary surveying to learn about how many individuals are really aging and turning into the senior category. So in Staten Island, there are about 45 provider agencies serving thousands of adults with autism and developmental disabilities. Preliminary data indicate that each agency's current population of seniors over 55 years old ranges from 4 to 48%. It's an average of about 22% of the agency's combined total population being over 55 years old, and this number is rising. Currently, our adult program models that we have in New York are a day hab. These are services that assist or support the individuals in developing or maintaining life skills and community integration. We have a lesser restrictive kind of setting called a day hab without walls. And this is really giving our individuals more opportunity to utilize skills in the community. These individuals would have lower support needs than those in a traditional day hab. And then ComHab is even less restrictive. And this is really basically one-to-one training to develop or enhance the skills needed to live more independently in their homes or in the community. A big focus of all of these programs has been on community integration. In our experience, we need to start planning for senior center activities and building strategic partnerships to develop options that will meet the needs of our aging individuals. Still, a big focus is on preference and choice, building a robust schedule of meaningful leisure, health, wellness, and nutrition activities. Just some examples of some of the things that we're doing with our individuals: bowling, going to a gym and working out. The golf simulator is a nice lifelong leisure skill that we're teaching. Obviously, eating out and doing just some work at their desks in our program. We integrate a lot of choice in our programs. Here's a little yoga lesson, little dance and music and movement. This was a fun activity, paint and sip, sparkling cider here. We brought in a vendor who helped us do a paint and sip for some of our adults, making simple meals. And here we start bringing in some reptiles and animals from the zoo into our program as opposed to going out into the community, because like I said, accessing the community for some of our high support needs individuals is tough. So we're thinking about ways that we can bring the community into our programs. So the way we're doing this, because there really are no senior centers designed specifically to meet the needs of individuals with autism, is we're starting to visit some senior services day programs for the typical population to see if we could learn about the activities that go on there to help us replicate what might be part of the programming in a senior center for individuals with autism. So a lot of it is focused on health and nutrition and food and dancing and music. So what we're learning now as we develop our senior programming is that we need to rely more on interdisciplinary support, right? We now are looking at including more medical professionals, speech language pathologists, psychologists and psychiatrists, public health officials, social workers, and experts in the field of aging. And we need to really start bringing in a lot of these resources to meet the needs of our aging population. And it's tricky because we're just not funded to be able to have all of these things in our day programs. So the components of the program that we want to develop is to make sure that our environments and programming are very attractive, that they're promoting quality of life programming, and they're staffed by specialists with expertise in the field of autism and aging. More specifically, we're looking at making ADA modifications to our facilities by adding ramps and really paying attention to the furniture and the fixtures that we're putting in our facilities. We want to balance comfort and beauty with extreme safety and security and durability issues. So we're thinking we might need some more center-based options here, but we want to be careful about talking about center-based options because there really is this need and big push in New York for community-based programming. So we want to be careful that we're not going back to creating segregated environments. Again, I can't emphasize enough the importance of staff training. Provider agencies and the Office of People with Developmental Disabilities need training in the aging process and how this may look in people with autism. We need more medical support and training because we have to deal with now issues not just with autism, but with diabetes, vision and hearing loss, mobility issues, heart disease, dementia, depression. So we are really heavily focused on promoting health outcomes and community outcomes. And I'm just going to take you through a little document here where the focus of the health outcomes, whether it's Special Olympics, whether it's day programs for individuals with autism, whether it's a senior center, whether it's a school, some of the health outcomes we're looking for are establishing social networks, right? So maybe having games and special events and sensory rooms and activities. But the way we might customize this for people with autism is, instead of eating meals in a big congregate place, we might have space for one-to-one meals, because many of our individuals have sensory issues, restrictive repertoires of food, might not enjoy eating in a large group. So these are some of the modifications we would make. Another health outcome that's really important for our aging individuals is improving strength and balance, right? So we would have physical activities that allow people to live longer and healthier lives, and a variety of exercises and activity classes. And for our individuals with autism, we might customize it by providing visual schedules of these activities. Maintaining cognitive health is an important outcome for our population. Lifelong learning as appropriate, right? So computer literacy, brain health and exercise, current events, these things keep our cognitive health strong. For our individuals, we might have to apply some more direct instruction than just talking about current events in a group setting. Positive nutrition is another health outcome that we're focused on. In later life, eating well can be the key to staying mentally sharp, emotionally balanced, and energetic. So we might provide potluck lunches, cooking classes, activities on healthy eating. And again, for individuals with autism, we would customize it by being sensitive to their food selectivity and sensory issues. As far as community outcomes, one of the outcomes is to have the highest level of community involvement. Members, we want to bring in members into our program and have volunteers be part of our program and match the services for the individual with the volunteer's interests. And something that we might do to customize it for our population is to be open-minded about their interests and be creative with their age-appropriate interests. So what are ways that we can incorporate maybe immature or childish kind of interests into something that might look or feel more age appropriate. We want to provide resources for individuals who age in place. So we want to give access to opportunities for socialization and mental stimulation, access to transportation to and from medical appointments, and we might have to pair these kinds of activities with special reinforcement. Pairing your favorite activity or your favorite person, or maybe your favorite book when you go on these appointments, could make some of these things a little bit less aversive. As far as health screenings and chronic disease management and targeted exercise group and fall prevention programs, again, we might focus on discrimination training. When you go to the doctor this time, it's a well visit. When you go in this room, you might need to get a flu or other vaccine, right? So, and we might want to minimize some of the transitions for individuals with autism, because it could be very stressful for them to go from place to place to place. I included some resources here for you guys on aging, references in aging and autism, some references in teaching leisure and recreation skills through evidence-based practices. And that brings us to the end of the slideshow.
Thank you so much. Does anybody have any questions? You can feel free to come off of mute, or you can send anything in the chat as well.
Hi, this is Shirley Madewell. I work for the New York State Department of Health. That was Randy, that was just one of the most amazing presentations I've seen, and I attend an awful lot of presentations. I work in the disability and health field, and my goodness, that was just absolutely amazing. Kind of one of the things that you said stood out to me, because I'm always thinking about where can we do more at the state level, and hearing this sort of lack of training, maybe for staff to really kind of be the supports they need, maybe in terms of what's needed in helping to recognize people as they're aging, what the risks, what the healthcare risks may be. can you say a little bit more about what might be, do you think, some valuable education either for staff or for um, uh, caregivers or parents as people are growing older, something that might be helpful that maybe we could think about trying to work on?
Yeah, I appreciate your comments. Thank you. And I'm glad that you thought the information was valuable. It's really, there's not a lot out there guiding our practices with the aging population. So we're kind of just learning as we go. We're part of an interagency council. I don't know if you're familiar with the Interagency Council of Developmental Disabilities, New York City and state.
I'm not, but I'm kind of new to my position, so that's something I want to jot down so I can get more familiar with that.
Yeah, so at Eden too, we're a provider agency. We just developed an advisory board where we're including experts in the field of aging and autism and, clinical people, behavioral people. And tomorrow, actually, we're having a think tank in the city. And it's like a 5-hour, meeting really to plan a blueprint for, what the challenges are and what the needs are and what we need to do as a provider association in terms of policy and advocacy and education and training. And, the state education department and the Office of People with Developmental Disabilities that oversee our agencies and regulate our agencies, they are looking to us also to give guidance for what's needed to better support the people that we're serving. Unfortunately, a lot of it comes down to finances, right? We're not funded in our rate for any of those things that I discussed, like to have physical therapists, to have psychiatrists, to have more skilled nursing. I mean, it's just we're really at a tragic point in our field in terms of having these skilled clinicians. But I think the local trade associations, there are advocacy organizations across the state, and Madison can connect us, Shirley, you and I, and we can continue this conversation because I would love for you to be part of what we're doing to kind of create this strategic plan for meeting the needs and get more skilled people in the workforce. I think you would bring a very good perspective to that.
That would be wonderful, and perhaps the outcomes of your think tank, if at any point you're interested in sharing some of the things that you come out with. I'm looking for I'm looking at the world of the intersection of disability and health, but trying to look more broadly than and unfortunately, when somebody says disability, people think it's somebody in a wheelchair, and they don't think about the real complex web of pictures that are going on.
Yeah,
And so populations are really getting lost in that shuffle. So
yeah,
it's really important to me to bring visibility, especially thinking about this group. I don't think I had thought about it from the perspective of the aging individuals with autism and what that not just would mean for them, but for their caregivers, givers, and parents as they have aged and then perhaps passed away. What ends up happening to those adults?
Well, yeah, that's the problem, right? As our population ages, their support networks are
Yep.
aging too. So it really is a very scary time. And,
Yep.
even we have about 10 residences. We support about 80 or 90 individuals in our group homes. And even our individuals can't age in place in those group homes. They have steps and, we're just, nobody really thought about that years ago, right? These were like young, otherwise fit and mobile kids running in mainstream races, and now they're in their 40s and 50s and, experiencing a lot of issues with accessing their day program, getting on and off agency vehicles that don't have ramps or might not be accessible. So, I mean, all of this is coming into play now. So, it really is the time for everybody to focus attention on how we're going to get the resources we need to meet the needs of this population.
Yeah, thank you so much, and thank you so much for the incredible information. Absolutely amazing.
Thank you. Thank you.
Are there any other questions, comments?
Hi. So I have an 18-year-old, sorry. I have an 18-year-old male and I'm starting to plan for um, him. He's decided to stay with school till 21. But what you were talking about in the beginning really I can relate with, which is giving him a choice to do social activities. It's a big challenge for us. He makes little accomplishments, some accomplishments, but we'd really like to try to find more options for him because like you said, I think if we give him more options, there might be something he chooses to do. Um, do you have resources, and maybe they're beyond what I have available to me to try to find more options for social, activities like that, or
Yeah. Where are you located?
central New York, so around Binghamton?
Okay, yeah, I can connect you with some of my colleagues that are in that area. Binghamton University has some nice programs and services. I'm not really sure, COVID really hit us really hard with social stuff, right? Because we were
Yeah,
isolated for so long. And then when we came back from COVID, the workforce resignation hit us hard. And even if we
did.
found a place for our individuals to go to, we had no staff to support them there. So we're
Yeah,
kind of like just coming out of that now. And I'm
right.
seeing more and more like social skills groups and stuff like that. But I think we have to, there's one example. One of the individuals that I support wanted to be better at public speaking. So
Mhm,
he took very like it's in the mainstream, a class called Toastmasters. And it's
mhm.
for people who really want to learn how to like public speak. And like that was one way to get him with other people who didn't have autism, but they were shy and they were awkward and they didn't really like to talk. And he learned a lot in that environment, right? So, I mean, I
Mhm.
think we have to think about what are those things too. And then,
Okay.
I look at adult education. I live in Long Beach, Long Island, and
Mhm.
every school district around here has like adult education catalog of things,
Yeah, yeah.
whether it's pickleball or knitting or chair yoga or Excel spreadsheets or, those kinds of
Mhm.
things. And I think if even those things promote socialization and interaction. So, I think you could look towards those kinds of things, and then I can put you in touch with my colleagues who are in that part of the region to see if there's anything specific he might like.
Okay. All right. Thank you very much.
You're welcome.
And and I really did like your presentation as well. So thank you for this.
Thank you. I'm glad it was helpful.
Are there any final questions? Perfect. So I will make sure to connect everybody after this presentation as well. Thank you all for taking the time tonight to log on. The video of this virtual recording will be posted on our Special Olympics New York YouTube page later this week. So please feel free to share the recording with anybody that you know. I will also send at this time a Microsoft link through the chat. Um, that link is an opportunity to give us some feedback on our forums, provide some information on future topics that you may be interested in, or to ask any further questions that you may not have been comfortable asking on the live offering. And I think that is all for tonight. So thank you, Randy, so much for presenting tonight. Again, I really appreciate everybody hopping on. We do have a forum on October 22nd at 6:30 coming up, which will be a workshop for parents and guardians regarding sexuality and developmental disabilities. So if you are interested in that, please check out our website. But other than that, thank you, everybody. Have a good night.
Thank you. Good night.